A warm welcome to all our viewers to our series, Natural Medicine. I recently had the great pleasure of having a Zoom call with a trauma surgeon who is also a sports traumatologist. And I still have many questions about pain. So I'm happy to be able to speak to her again. Welcome, Dr. Martha Schmid. Hello.
Hi, I'm happy to be here again.
Great. So in bilateral talks, where the viewers weren't there yet, you also told me that you're also involved in mountain rescues, sometimes with the helicopter. Patients in front, like on TV, right? Like we see it in the movies.
Unfortunately, that also happens in real life.
Well, yeah. So let's delve into the topic, the tiresome topic of pain, please. Now, you've certainly experienced a lot when patients are in pain. They can hardly stand it anymore. Then maybe they'll get morphine or other painkillers. And then it still hurts. And then we talked last time about the fact that you can also work with light therapy, which provides relief. Can you tell me a little more about how the patients feel?
Of course, pain is a drastic symptom of many diseases. It is not only the acute pain after an injury, but there are also often degenerative processes, changes caused by wear and tear, that take place in the body. So, arthrosis, muscle diseases, changes that occur after surgery, scar formations that trigger altered mechanics. All of these can produce pain. And pain prevents movement. Pain creates stress. Pain is life-limiting and reduces the quality of life. And here, a small relief often has a very large positive effect on the overall quality of life of the patient.
Yeah, I understand. I also know people like that. Then they can't sleep at night because of the pain. So how are you supposed to cope during the day when you haven't slept? It's a spiral that goes down forever. And the level of pain that can be endured also decreases over time. You just can't take it anymore.
Of course. The body also has a pain memory, and it recognises certain pains immediately, or they are maintained to generate certain protection for the body, and also limit the body. And there it is really important to help and support, because the musculoskeletal system is what keeps us going. Not only the bony system, but also the muscular system, fasciae, ligaments. All of that belongs together, and pain in that area is annoying and literally paralysing.
Now, for example, if I get an injection of morphine or have to take painkillers, is it always some kind of remedy that actually works in the whole body? On the other hand, with light therapy, I can act exactly at the point of pain. Isn't that a great difference between these two types of pain management?
It even goes much further. If you take pain medication, then you have the pain relief as an effect. We all know that if you read the package inserts, medication has a huge part of side effects, although not all side effects have to be negative. It is only an effect of the drug in addition to the desired main effect. And sometimes they can be annoying. Take only the non-steroidal and anti-inflammatory drugs. So Voltaren, for example, if a patient has a weak gastric mucosa, then they will soon experience discomfort in the stomach area. But this is an effect that you don't necessarily want in pain therapy. With light, I can not only treat the pain, but can also reduce stress in the body. That alone is part of the pain therapy, and it supports the body in its regeneration. Because reduced pain also means, as you said before, that patients can sleep again. And only when we sleep, reparation, so healing and restoration, can take place. That means with light I can heal and support selectively, but also in general.
Now, I'd like to go into the pain perception of patients. Is there somehow a scale where you can say pain sensation from 0 to 10? And if you come in with light therapies, that is reduced. Have you ever collected such measurements of experience?
Of course, that's one of the basic empirical measurements that take place right at the beginning of everything. Because pain is something very subjective. And a patient, when they hurt themselves, let's take the simple sprain of the ankle. The patient says, okay, ankle is sprained, yes, I know, nothing exciting. Another patient is unable to walk for a week because of great swelling, severe pain, can't stand up. Pain is something very, very subjective. Nevertheless, I can use the scale from 1 to 10 for everyone. And when I work with the device, the pain is minimized very quickly to a tolerable level, or even to a pain level that no longer exists. So I also get a pain level of below 1, so 0, and that is freedom from pain.
Well, that's a miracle. I mean, every reduction, if I can't take it anymore, it's a blessing. And immediately you can take a deep breath or maybe even sleep again. Now, I recently saw in a hospitalisation, not of myself, but someone in the family, that they had no idea at all about light therapy. And then the patients were always injected with morphine or given pills en masse, just to get this pain under control. Is it just still in its infancy that you can work with it?
Yes, unfortunately, it is not yet distributed so far that it is used everywhere. However, the trend is increasing since the freedom from side effects and the high efficiency of the therapy are becoming more and more well known, and thus it is also becoming more widespread in therapy.
Would a hospital accept it if a guest came to the patient and brought a light device with them, so that the patient can treat themselves with it in the hospital? Would that somehow be objected to by the doctors in the hospital?
It would certainly be questioned. It depends on the treating doctors whether they tolerate it or not.
But you could do some research, and the literature is clear, isn't it?
Of course. Nevertheless, if it is not yet established in the treatment rhythm or in the treatment allegory of this hospital, there is still a need for an explanation. Or, let me say, everything that is to be used in the hospital must also go through a long process to be used there. It's not that easy. I can't go there and say, I've got something. Respectively, the patient can't say, I use my stuff. It's not that easy logistically.
So as a patient, you don't actually have any freedom to support yourself a bit.
As I said, as everywhere, people come together when they talk. That means it's always worth trying. It's always right to mention it. And it is always right to offer it.
Now, we've had the focus on the pain. What about wound healing? Is it the same procedure that wounds heal much, much faster?
Of course, because I can support changes, improvements, optimizations in the cell itself, of course. Also, wound healing, which the cells per se are not only involved in, but have to carry it out, is accelerated. And that is also possible in a much faster time, since the cells can work more effectively. And every process is accelerated and supported in terms of its efficiency and timing.
So that sounds to me like a medicine cabinet that everyone should have at home. You nod, you have it at home too.
That's exactly right. You can treat acne from young girls or even boys, up to dental problems. So the whole list of diseases. I can use it for growth problems in children as well, as in arthrosis or in spinal problems, intervertebral disc problems, muscle tension, as well as injuries in the sense of ligament strains, ligament tears, muscle strains, tendon problems, bursa inflammation. You can use it anywhere and you can't do anything wrong. You can support and relieve the body by reducing stress and supporting the work of the cells in the sense of healing.
Well, if I just look at home now, what construction sites we have, the little one has back pain right now. It would be perfect. Another one has slight acne on the cheek. It's new to me that acne can be treated with light.
Inflammation of any kind. You can support the body just like with neurodermatitis or psoriasis. Acne is also an inflammatory skin disease, and you can support there, and for young people in particular. Scarring from acne results in permanent damage, and even if I can only provide a little support here, it is the patient's psyche that is suffering greatly.
If I don't have anything now and would like to use it preventatively, where would you start with this device yourself? Would you somehow put that on your head or on the soles of your feet, or how? How do you support your body?
You can, of course, use the soles of your feet and the palms of your hands, simply because there are all the reflex zones. Here, you also have the beginning of meridians, because I can also work regulatively here. You can work regulatively via the solar plexus, especially if you want to relax in the evening, fall asleep more easily, sleep better through the night. Then I would recommend the solar plexus. To support the detoxification that takes place at night, you can also irradiate the liver. This is also something that takes stress away from the body and supports regeneration. You can irradiate the kidneys to support elimination here as well. And as soon as all internal organs can work better and more efficiently, the entire body relaxes.
I want to repeat. Solar plexus, the lungs, the kidneys,
the liver,
and the liver, good. And via the meridians, the fingers and the soles of the feet.
Yes.
Now, do you happen to have such a device nearby to show us how it works?
Of course, I always have my medicine cabinet handy.
Great. Can you switch it on so we can see what it looks like?
It flashes rather brightly.
Yeah.
It is applied directly to the skin.
Yeah. It goes deep, doesn't it?
It doesn't get hot. There are no skin changes. So commonly, it is always said the cold infrared, or I want the infrared. It's not infrared, because if you put infrared on the skin, you have a huge burn. This light is cold light and can only support and activate the cells. It cannot cause any burns.
Well, you can see that it goes through about half the hand. No, all the way through. Even through the hand.
Yes.
So that's the whole hand.
It's very bright. I don't want to take my hand away now. It's really very bright in the irradiation. You see how high the intensity is.
Very exciting. So is it bad for your eyes to look inside?
It comes with goggles. You shouldn't look inside. It's like looking at the sun. You get flash, and it's advisable if someone has very sensitive eyes that, of course, they put on the glasses. No question, of course.
But wouldn't it be harmful?
No.
Not that either.
Nothing can happen.
Fantastic. And it's all backed up by scientific studies. Wound healing, pain relief.
Everything backed up with studies, of course. And in medicine, it is only allowed to work on patients and to treat patients with a device that is approved as a medical product.
So, but I think I read that there is actually one company that has this approval worldwide.
Correct. It is also unique because it's visible light. And the Technical University of Vienna has the patent for it. And it's almost like patenting the sun.
Amazing. And may I ask, since already we have a doctor here, if people seem to develop degenerative diseases, for example, in the head area, I'm now talking about maybe Alzheimer's, maybe a slight dementia. Would you also say, from your experience, you should just irradiate your head a bit with it? It doesn't do any harm, but it can be of use.
In this case, I would not irradiate the head directly. I would work regulatively there.
Regulative means via...
Regulative means via the solar plexus.
Oh, again there.
Now, to irradiate the brain directly, I have to admit that I don't really have the experience yet. Nevertheless, I have experience with other light devices that were forerunners of this device, where you still have used the entire rainbow. So, white light therapy, if you will, slightly optimized and improved. And here you can definitely support. I would work regulatively with repulse and radiate all centers that optimize and regulate the metabolism.
Great. Now, I have it at home, and sometimes I don't know what great stories, great things I have at home. But when you're sitting in front of the TV with your feet up like that, it doesn't hurt to put a little bit of energy in here and there, does it?
That's exactly right. It's just a therapy that you can use at home, that you can use daily for chronic complaints, or in regulation therapy, and which you can also use a little bit on the side.
And that was a great keyword. I'd like to repeat it again. Even if people are already receiving medical treatment at home and are really in pain, you can at least get relief with self-therapy, with this pulsed light therapy.
Definitely. Nevertheless, I would of course discuss this with the treating doctor, because every therapy which influences the treatment should be discussed with the doctor treating you. Because nothing is worse than not knowing what my patient is doing as the person treating them. Because all other therapies can then be coordinated with it. And it makes sense to discuss it, and most importantly, the doctor who knows the device, who works with it, can also optimize the therapy for the patient. Irradiating somewhere in the blue often does not bring the desired success, and then people say the device does not work. And I want to avoid that. That is, the setting, or the really optimal use is often supportive or is given by the doctor, like a drug, if you will, or shown as a physical therapy, so that the patient really has the best possible success in an optimal unit of time.
Yeah, I completely understand. And among other things, they can then possibly reduce or adjust the medication, which only they can do.
That would be exactly what is desired, that you can then decrease the pain medication to support the body and not run the risk of having to accept any side effects of medication.
I'm through with my questions. Dear Dr. Martha Schmid, thank you very much for taking the time to enlighten us about this very, very exciting revolutionary advancement. What makes me very happy is that we have something in hand to preventively do something ourselves, and it's useful.
My pleasure.
Thank you very much. Dear viewers, thank you very much for watching. Please also share this broadcast so that as many people as possible who are plagued with pain or in the area of lack of wound healing see an option, a possibility to do something good for yourself here, to speed up this process, reduce pain or promote wound healing. And I think even scars can heal much better. I read that too. That's great, isn't it?
Yes.
Perfect.
Yes, that's correct. Scar remodeling takes 6 to 9 months, and you can provide very efficient support during this time.
That's it. Many thanks. All the best to you. See you next time.